All right, guys, so I'm going to show you how to identify anatomy on the CAT scan image. Remember that this scan, the link to this scan is in the course. It's under research and helpful links. So just click on that and it'll take you here to the normal CT of the abdomen in Radiopedia. So, and remember, for any tests that you have, the images for the tests come from these studies. So you can always refer to these studies to study for the test. I'm not going to pull in just some random CAT scan. So if you review these, you should be very well prepared for the test. All right, so starting out, first thing you need to do is feel comfortable scrolling back and forth, or up and down rather, in your scan. And then you want to always either start all the way at the top or all the way at the bottom so that you can see where you are and kind of get your bearings of where you are anatomically. And then you're going to have to learn to follow anatomy that will help you to find certain other harder to see anatomical parts. So everybody has usually no problem finding the liver or finding the kidneys, but it can get kind of hard to find the pancreas and follow all parts of the pancreas, delineate certain structures from other structures. So it's easier to start at the top or the bottom of a scan, or if you're in a coronal plane like here, to start all the way at the front and then work your way back, or start all the way in the back and work your way front to get your bearings of where you are anatomically to find your structures. So let's go back to the axial. All right, this is our axial CAT scan of the abdomen. We're going to start all the way at the top in the lungs. So here's the lungs. Here's the left lung. Here's the right lung. Remember, it's hung anatomically. Here's anterior and here's posterior. So start at the top. First thing I want to point out is we know that the very top of the abdominal cavity is the diaphragm. So when we talked about the 3 openings in the diaphragm that they act as like a conduit for certain structures to travel back and forth between the thoracic cavity and the abdominal cavity. And those 3 openings are the aortic hiatus, the esophageal hiatus, and the caval hiatus. Okay, remember the caval hiatus has the inferior vena cava, the aortic has the aorta, the hemiazygos and the azygos veins, and then the esophageal hiatus has the esophagus and the vagus nerve, I believe. So here we go. Those are our 3 openings from the thoracic cavity down into the abdominal cavity. Starting all the way at the top, it's easy to start with the aorta and follow the aorta down, and you're going to start seeing some branches coming off of the aorta. You have the celiac artery, the superior mesenteric artery, the inferior mesenteric artery, traveling all the way down, following the aorta, and eventually it's going to branch. And then that's your bifurcation of your left and right common iliac arteries. Okay, so this is why, I mean, if you have done this enough times, you can scroll all the way down here and know that this is the right and this is the left common iliacs. But when you're first starting out, you would want to follow the anatomy. Same thing with determining the celiac versus the superior mesenteric artery. You want to make sure that you're superior and then you move down inferiorly to know which is which. So if you're in the middle of a slice, it's kind of hard to tell. But we'll go over that when we do the vessel, the blood supply in the abdominal cavity next week. So there's the aorta. Next thing we want to look at is the diaphragm. So remember, the diaphragm is the most superior portion of the abdominal cavity. Here's your left diaphragm. Here's your right diaphragm. They connect the diaphragm to the lumbar spine, and then they're connected anteriorly by the median arcuate ligament. So there you go. There's that. Next thing we want to do is remember, looking at the diaphragm, we can use that to help us find the adrenals. So first thing, to find the left adrenal, remember, you're going to draw a triangle between the aorta, the tail of the pancreas, and the kidney. So here's your left kidney, here's your aorta, and here's the tail of the pancreas. And see how I'm scrolling up and down? I'm just trying to see where it is in relation to other structures, so I'm not looking at the small bowel right here, which to the untrained eye, I suppose could look like the pancreas. So here's the tail of the pancreas. Draw a triangle, boop, boop, boop. Here is your left adrenal, okay? So there's your left adrenal gland right there. All right, now let's look for the right. The right adrenal lies between the right crust or crux of the diaphragm, the right lobe of the liver, and it's just posterior to the IVC. And here's the IVC. So this little sliver here is the adrenal gland. It's really hard to see. It's hard to tell. You're getting a little slice of it there, and then it's going out, and there it's gone. So adrenal, 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 adrenal. This is probably the best shot of it. And then now you can't really tell the difference between adrenal gland and liver. So there you go. There's your adrenal gland. Kind of hard to see on the right. So now we can talk about kidneys. They're pretty easy to pick out, left kidney, right kidney. And just like we talked about, let me go back up again, start superior and go down. The first kidney you should see is the left kidney, because it always lies more superior than the right, because the right has to make space for the liver. All right, so right kidney, left kidney. It's on an oblique plane, so you can see that there. And then scrolling down through your kidneys, you can see here we have the cortex of the kidney and the medulla of the kidney. And then as we start going down in, here's the collecting system, and here it's not quite highlighted. So you guys now should be able to recognize that this isn't either an arterial phase or it's an earlier arterial phase of CAT scan. This indentation in the kidney that allows for the ureters, the renal arteries, and the renal veins to enter and exit is the hilum. So remember, the hilum is always going to be like an indentation in the organ that allows for vessels and kind of like the guts to go in and out. It's like a conduit in and out of the organ. So there's your left kidney hilum, and here's your right kidney hilum. It's kind of a little offset a little bit here. Okay, so those are your kidneys. Here's your spleen coming in over here. There's your spleen. And here we go. The indentation on the medial side of your spleen is the hilum of your spleen. And that allows for the splenic artery, the splenic vein to enter and exit the spleen. Okay, and there it is. So starting all the way at the top, you're going to start seeing spleen come in, and then it's going to start going down, 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 and then it's going to be gone. And so to follow something down helps you to determine the difference between this little tail end of the spleen and this loop of bowel right here. Okay, so now going back up again, coming down, let's look at the liver. Liver's this big guy right here on the right side, right upper quadrant. Okay, you should be able to distinguish between the different lobes of the liver. I'm not going to make you know the segments, but you should definitely know the lobes. So first thing, the easiest lobes to find is the right lobe and the left lobe, right? So we have the coming down into the liver. Remember, we have the falciform ligament that splits the liver into the largest lobe, which is the right lobe, and the smaller one, which is the left here, okay? So that's your falciform ligament, which you can't quite see. We're just not hitting it at the right slice. But it does come through here, travels posterior to anterior, connecting and anchoring the liver to the abdominal wall. So here we have, that's where it is. And then remember, the round ligament comes off. It branches off and travels down inferiorly from the falciform. So we cannot see the falciform ligament here. We know it's there because we know that it separates and anchors the liver. But if we look as we go down, see this round grayed area right here? That's the branch of the round ligament coming off of the falciform heading inferior. That's the round ligament right there. Remember, that's the used to be part of the umbilical vein, remnant of the umbilical vein. Okay, so there's the round ligament. Other lobes of the liver, caudate lobe right here, most inferior portion of the right and medial portion. And then going down, here's your quadrate lobe. anterior inferior portion of your liver. Next thing we got to look at is the gallbladder. Gallbladder is going to be this dark, dense. It's because it's fluid filled. Remember, it's a sac that stores bile. So there's your bile, or your gallbladder with the bile inside it. And you can follow that all the way down. You can sometimes, if there's calcified stones in the gallbladder, you can see them as well. So there's the gallbladder. So the next one, which I think is somewhat the hardest organ to see in the abdomen, is the pancreas. And it's because it's kind of intertwined. Remember, it's the head of the pancreas kind of sits in the C of the loop of the duodenum. So it's kind of embedded in and surrounded by a lot of loops of small bowel. And loops of small bowel just kind of, they block it. They make it harder to see. The easiest part of the pancreas you should be able to see is the body of the pancreas here, and the tail is always going to be the easiest, okay? And then if you follow that anatomy as you go down, you know that the head of the neck of the pancreas and then the head of the pancreas is going to come over into a loop of bowel, which this guy, it's really easy to see, because if we start up, this is stomach right here, right? So this is stomach. It has contrast in it. This patient drank oral contrast. So we have the top of the stomach, the fundus, travel down, and then this is going to be the pylorus. And you can actually see where it empties into the small bowel. So here's the first loop of the duodenum right here, okay? First loop of duodenum, we know that right at that first loop, that first curve that's going to travel inferior is going to be the head of the pancreas. And right here is the head of the pancreas. And you can actually see the common bile duct heading superiorly right here into the biliary tree from the head of the pancreas, by the head of the pancreas here. Okay, this is small bowel. We're now out of pancreas. That's going to be probably the hardest thing to see on an abdomen CAT scan. So again, look for the tail first. It's going to be more superior. Here's the tail, body, coming over to the neck, and then head of pancreas. And if you're ever confused of where the head is, try to follow the duodenum coming out of the pylorus of the stomach. And if you can follow the duodenum, especially if it has contrast in it, look just medial to that, and that's going to be the head of the pancreas. Okay. Inferior vena cava. It's easy to see up top coming out of the heart, and then as you go down, it gets really muddied in the liver. But just follow this general area and look just to the right of the aorta, and that's going to be your inferior vena cava. And it gets muddied because it helps with the blood supply. It's part of the blood supply coming in and out of it. There's a branch coming in and out of the liver, and the liver filters blood opposite of like the rest of the body. So arterial supply is not the same as arterial supply in other organs. Same thing with venous supply. So it's going to be a little backwards, and we'll go over that next week. But it gets a little muddied as you travel, as the IVC travels through the liver. But once you get inferior to the liver, it's very easy to see the inferior vena cava separate from the aorta. It's always to the right side of the aorta, obviously, unless there's situs inversus. Okay, so there's the IVC. Coming back up again, traveling down again. Other things I want you to look at, which are kind of hard to see, a little bit of the mesentery, greater omentum and lesser omentum. You can see this little, like, not these blood vessels, but you can kind of see little dense areas, these little grayed areas in here. Those are kind of parts of the mesentery. And in here, again, remember, they suspend the organs in the abdominal cavity so they don't just all fall down to the bottom. The big one that I really do want you to be able to see is the renal fascia. I want you to be able to see renal fascia, and here it is right here on the left side. And then over here, here it is on the right side. Okay, and remember, geratus fascia, or the renal fascia, is what separates the posterior pararenal space from the perirenal space. Okay, and remember that perirenal space travels in here and around and encapsulates the kidneys with perirenal fat protecting them and cushioning them from injury. And here's that fascia right here, the renal fascia, Gerada's fascia. The space inside is the perirenal space, and just posterior to the renal fascia is the posterior pararenal space. Over here, here's the Gerada's fascia right here, posterior pararenal space here. On the inside is the perirenal space. Okay. You can see the perirenal space a lot easier than you can para. And remember, any of the spaces in the abdominal cavity are very difficult to see unless they're filled with something like ascites or fluid. So without having any fluid in this abdominal cavity, it's very difficult to see any of these spaces. So that's why you can kind of make out the renal fascia. You can kind of make out the pararenal space, but it's very difficult. The only other thing I want to point out to you is you can kind of see the mesentery down in here. See this like squigglies? If you imagine how the mesentery looks, if you've ever seen images of it, and you know that it's this big curtain that falls over the front of the abdominal cavity and the abdominal organs, and it has all of these fat pockets embedded into it, you can definitely see how it looks in here. And you can also see the little fingers of the mesentery that are feeding and holding up all these little different loops of bowel. Okay, so see them all in here. This is all mesentery in here, holding up these loops of bowel. Okay, so those are your main anatomical parts that you should be able to see on a CAT scan. You should always, again, start at the top and travel down and look at your anatomy in relation to other anatomical parts. That's going to be the easiest way for you to be able to find any of these anatomical parts. All right. As far as the intestines go, the bowel, small bowel, I'm not going to make you know and be able to tell me jejunum versus duodenum versus ileum, but I do want you to be able to see the first loop of bowel coming out of the pylorus of the stomach. You definitely should be able to see and tell me that this is duodenum, because you know that it comes right out of the stomach, and you should know that this is the stomach. Okay, so I'll ask you easy things like that. I'm not going to scroll down to the center of a scan and say, what loop of bowel is this? Is this jejunum? Is this duodenum? Or is this ileum? I'm not going to make it that difficult, but I do want you to see in relation to other anatomical parts what you're looking at. Okay. Same thing with small bowel, or I'm sorry, large bowel and cecum rather. You should be able to tell the difference between large bowel and small bowel. And you guys know that because you've learned about haustral folds. And these are the classic haustral folds of the large bowel. You know that you have bowel on the right side. You know that you have bowel on the left side. All right, it's harder to see ascending versus descending. But you can see over here, this is ascending colon on the right side. This is the most inferior portion of your colon on the right side. If I go down, is always going to be cecum, right? And that should make sense. And then as you go up, you know that this is your ascending colon. You can kind of follow that if you want. But again, I'm not going to make you know the specifics as far as that goes. But you should be able to tell me that if the colon here, you know that this is colon because it's got haustral folds, and because it's traveling transversely, it's pretty easy to tell that this is transverse colon, right? But here versus here, not so much. I want you to know transitions, and I want you to know the main parts of the anatomy. And colon and bowel, you guys aren't radiologists, you're not going to have to know that. All right, so there you go. I hope this helps.